We're live. All right. Good morning. It is Thursday, March 27th, and this is Senate Health and Welfare. This morning, we're looking at some of the bills that have come over to us from the House just to get an understanding of what is what. And so we're hearing from reporters of the bills, representatives from the House and our ledge council. So, good morning, Representative Black.
Good morning.
I think you know everyone here.
What's that?
Do you know everyone here?
I believe so.
Okay.
I feel like I've been in here a couple times,
Yeah,
which is
more than
pretty
you'd like.
bad because I thought when I became chair, I wouldn't have to report bills anymore. And yet it seems like I'm constantly reporting bills.
That's a good thing.
It's a good thing. And this was an important bill, and that's why I felt the need to do that. So I'm here for H482. And I just want to acknowledge from the get-go, this right here,
Uh-huh.
this is S126.
Act 126. Our birthing event.
This is, I have been reading this bill for the last 2 weeks since you passed it out. Our committee has already started taking testimony on it. I am excited. I am grateful to all of you for the enormous amount of work that you put into this. And this is a fantastic roadmap of where we need to be, because we all know you all sit in this committee, just like all of our committee members sit in House Healthcare. You know that we are in a crisis, and I am grateful to you for this and cannot wait to get to work on it. This is H482. This is not that. These are long range, medium range goals and aspirations and where we need to go. This is about the crisis that we're in right now. So H482, and I will say worked in great collaboration with you, Madam Chair, on this as well. This gives temporary authority to the Green Mountain Care Board in certain instances.
My message, I was going to be late. Yes. Okay.
So she-
Yes.
In only very specific instances when faced with the insolvency of our one domiciled insurance company, that the Green Mountain Care Board can take action to adjust rates for hospitals and hospital networks that are materially non-compliant with their budget orders. And it only pertains to hospitals or hospital networks. And it does expand to hospital networks. And I know S126 also expands authority to the Green Mountain Care Board to the network level. And it also allows the Green Mountain Care Board in certain circumstances to appoint an independent observer. One of the things that we rely on our regulators for, and I know that you heard this from Nancy Kane came in here. We regulate hospital budgets, hospital revenue, insurance rates, only based on the information that's provided. That is the best that they can do. And when they are being presented with information that is not correct, it's very hard to make adjustments and to make determinations. And getting it wrong in one place has an effect on the entire system of care. So there's an independent observer, and I want to acknowledge that I'm sure all of you saw yesterday that the UVM Medical Center, UVM Health Network submitted a proposal to the Green Mountain Care Board to mitigate some of the overages that they've had to help Blue Cross Blue Shield of Vermont to invest in some primary care. What this bill does essentially is what the UVM Medical Center and Health Network decided that they should do on their own. I guess the one thing I wanted to say was, why should we do this bill? And why should you take this bill up? Because we did this a week ago. And the situation is now completely different. And I was thinking, well, why bother? Why bother? And I think one of the things that, you know, the Green Mountain Care Board has been negotiating with the Health Network. Chair Foster in their meeting yesterday, if you had a chance to watch it, talked about, you know, the talks they've been in for several months. I think what this does, and I talked about this in my bill report, it is the sincerest hope by everyone that we will never ever need to use any of the provisions in this bill. Nobody wants that. But this is an opportunity for the legislature to say, this isn't right. And giving our regulator the tools to do the job that we have, that we appropriate to them and that we have tasked them to do. This is a message that we're sending to Vermonters that this is something we care about, and this is something that we, the legislature, want to ensure happens. This is actually our voice. And frankly, as much as the work that the Health Network or all of our hospitals or the Green Mountain Care Board does, myself and everyone sitting around this table and everyone sitting at every other table, we are the only people in this story that are directly accountable to Vermonters. And I think we should be passing this, whether we need it or not, to let Vermonters know we are taking this seriously and we have a voice in it because we represent them. So, and I'm not going to walk you through the bill. I'm going to let Legislative Council do that. Any questions?
So you're not very supportive of the bill that you had.
I am very supportive of the bill, and I am also incredibly grateful to the chair of Senate Health and Welfare for all the work that you've done on this as well, and all the work you've done in 126, all of you, all the work that you've done in that. I have thoroughly enjoyed the collaborative relationship on this.
It's been good. This is good, and we'll continue to work together to try to get to the place where we need to be. I know there will be concerns about both your bill and our bill, but we need to get to a good resting place for both of them. So, yeah, I appreciate all the work you've done on this. It's a lot. It's a lot, and it hasn't been easy. Yeah, when you're under the spotlight, it's very difficult. Appreciate what you're doing. Okay, questions for Representative Black?
No questions, just gratitude for you and for you. These are hard times, and thank you for the work you're doing.
Good. All right. Now we get to see the bill. And it would be helpful to see your floor report at some point. We can. But
Happy to send it to you.
All right. Good. Thank you.
Good morning, Ben Cardy
Good
from the
morning.
Office of Legislative Counsel. We are put up on the screen, looking at H 482, which is an act relating to Green Mountain Care Board authority to adjust a hospital's reimbursement rates and to appoint a hospital observer. I do want to make it clear that some of this is time limited authority, and then it has a sunset. Not all of this has a sunset, but it does have very specific triggers. So in section 1, this would be adding a new section to the Green Mountain Care Board chapter in Title 18, entitled Reduction or Reallocation of Reimbursement Rates, Risks to Health Insurer Solvency. It has a couple of definitions. Hospital has the same meaning as in section 9451, which is really all Vermont hospitals. That's in the budget review statute. And hospital network means a system comprising 2 or more, this will look familiar because it's in S126 as well. A system comprising 2 or more affiliated hospitals and may include other healthcare professionals and facilities that derives 50% or more of its operating revenue at the consolidated network level from Vermont hospitals, and in which the affiliated hospitals deliver healthcare services in a coordinated manner using an integrated financial and governance structure. This is the same
Very
definition.
familiar
Yes,
language.
that is in S126. But because we're using it in this section and it's not an existing definition, and the definition in 126 would add it in a different part of the statutes, it's here as well. So in subsection B, it says if the Green Mountain Care Board determines, after consultation with the Commissioner of Financial Regulation, that a domestic health insurer, so a health insurer based in Vermont, faces an acute and immediate threat to its solvency because its risk-based capital level has triggered a regulatory action level event, which is defined in statute in Title 8. The board may order a reduction of the insurer's reimbursement rates to 1 or more Vermont hospitals as set forth in subsection C of the section until such time as the amount of the insurer's risk-based capital exceeds the company action level risk-based capital threshold defined in Title 8. So it's using some language in Title 8 that looks at the amount of risk-based capital that an insurer has, which is a measure of its solvency, and says if it reaches below a certain threshold, then it would give the board authority to order a reduction of the amounts that the insurer would pay to 1 or more Vermont hospitals, and those are hospitals meeting certain criteria, until such time as the insurer's risk-based capital gets back to a level that is deemed more adequate under the statute. So in subsection C, it says the board shall only order a reduction in the reimbursement rates to a hospital that meets 1 or both of the following criteria. So a hospital would only be eligible to have its rates reduced if the hospital has more than 135 days cash on hand and had a positive operating margin in the previous fiscal year, or the hospital is a member of a hospital network that at the consolidated network level has more than 135 days cash on hand or had a positive operating margin in the previous fiscal year, or both. So it's either a hospital that meets both those days cash on hand and previous positive operating margin in previous fiscal year, or the hospital is part of a hospital network and the network had either 135 days cash on hand or at a positive operating margin in the previous fiscal year, or both. So this is a fairly small subset of Vermont hospitals, and I'll let the regulators tell you more about that. And then directs the board to order a reduction in reimbursement rates only to the extent necessary to remediate the threat to the domestic health insurer's solvency. So not a just because we want to go in at this point and make some changes. This is really focused on preserving domestic health insurer solvency. And in no event shall a reduction ordered by the board pursuant to this section result in a decrease to a hospital's or hospital network's projected days cash on hand to below 125 days. 135 days is the minimum to qualify to have the rates reduced. And the board can't reduce their rates such that it would reduce their cash on hand to less than 125 days. Do you want me to pause here? Because these sections are, they're both on the same general topic, but,
Any questions?
but this is,
For this one, so this really reflects, uh, we're saving our server persons.
right, it's looking to preserve the solvency and therefore the continued operations of a domestic health insurer by reducing hospital rates, but only if it's not going to have a significant negative effect on the hospital, recognizing the financial situation of many of Vermont's hospitals.
Was there any discussion about having an alternative to reducing insurer reimbursement rates as a remedy?
This is an option. It is not
It's
a requirement.
It's,
So the board may, on line 20 of page 1, the board may order.
but but
So there are
other
there-
options that were other options discussed during the committee. I should have asked Representative Block that question.
I think this was,
This was it.
I mean, I think this was the focus of this piece of legislation.
Okay, all right. All right. Thank
Um,
you. Sort that out.
Section 2 then is making some revisions to 18 VSA 9456, which is the hospital budget review statute. And you may recognize this statute also from our work on S-126, but these are some different provisions. So this does a few different things. So first, in the hospital budget review, and the establishment of hospital budgets, it says that the individual hospital budgets established by the Green Mountain Care Board and under current law shall, if the language says, reflect budget performances for prior years. This takes that language out and replaces it with reconcile any significant deviation in revenue during the previous fiscal year in excess of the budget established for the hospital pursuant to this section, using a methodology established by the board. So if there are any significant deviations in revenue up, above the budget established for the board, then the budget for the next year can reflect and can have a lower, for example, a lower budget to reflect the overage from the prior year. So it sort of looks to true up or balance out from prior year overages.
So they have to do it, shall.
This is that the individual budgets shall reconcile,
Okay.
but it would be
Even
using
in
a
the case-
methodology established by the board. So the board's methodology could, for example,
Okay.
take
You can
out,
leave out federal dollars paid in for the pandemic.
right, the methodology could, I think could include the flexibility to consider additional circumstances, whether that's federal funds from a pandemic or agreements like the one that we're just talking about with the chair to use budget overages for specified purposes for the benefit of Vermonters.
So they can consider externalities.
The whatever, it's going to be really based on what the methodology established by the board looks like. So
Got it.
want to hear from the board what their thoughts are on that, certainly.
Yeah, we'll have to do that.
All right, continuing the same section of statute, under existing law, the board may, upon application, so if the hospital makes an application, adjust a budget established under this section upon a showing of need based on exceptional or unforeseen circumstances, in accordance with criteria and processes set out in section 9405 of the statute. This would add new language allowing the board, so permissive, the board may, on its own initiative, adjust the commercial insurance reimbursement rates payable to a hospital at any time during the hospital's fiscal year in order to ensure that the hospital operates within the budget established under this section. So this doesn't require a hospital to reach out and say, we seem to be running over budget. Maybe you want to could you readjust our rates in the middle of the year? It would allow the board to do that on its own initiative to keep a hospital within its established budget. And then new language on page 4, still in the hospital budget statutes, but I want to be clear that this is the piece. I know that Chair of House Healthcare, when she was speaking, referred to material misrepresentation. That's really specific to this provision that we're looking at right here that says the board may, upon finding that a hospital has made a material misrepresentation in information or documents provided to the board, or that a hospital is materially non-compliant with the budget established by the board pursuant to this section, appoint an independent observer with respect to any matter related to the board's review or enforcement under this section, if the board believes that doing so is in the public interest. At the direction of the board, this independent observer may observe the hospital's operations, obtain information from the hospital, and report findings and recommendations to the board. It gives the independent observer the right to receive copies of all materials related to the board's review under this section, to the hospital budget review. And the hospital shall provide any information requested by the independent observer, including any information regarding the hospital's participation in a hospital network. It requires the independent observer, so it says shall, share information provided by the hospital with the board and with the Office of the Healthcare Advocate in accordance with subdivision D3 of this section, which is the part that says anything the Office of the Healthcare Advocate gets as part of hospital budget review, they must keep any confidential and proprietary material. They must keep confidential and not disclose. That's the reason for the reference there. But shall not otherwise disclose any confidential or proprietary information. So this is now the observer shall not otherwise disclose any confidential or proprietary information that the hospital observer, independent observer, obtained from the hospital.
Is the independent observer similarly encouraged to keep things confidential?
That's what that language right there says. Yes. So,
Okay, yeah.
yep. So the observer shall provide the information with the board and the healthcare advocate, but shall not otherwise disclose any confidential or proprietary information. And it allows the board may order a hospital to pay for all or a portion of the costs of an independent observer appointed for the hospital pursuant to this subdivision 2. There's no weird
Okay,
dash there.
there's a lot here.
Section 3 sunsets just that independent hospital observer authority. So that authority is repealed on January 1st, 2030, unless the legislature changes that. So just want to be clear that section 1, and it's just the hospital observer part. The rest of the bill would stay in effect indefinitely unless and until it was changed by the General Assembly. And the act itself would take effect on passage.
Okay. Good, thank you. This is great. I know that the only testimony the House heard, I think, was from the chair of the Green Mountain Care Board, unless I'm mistaken.
And the Vermont Association of Hospitals.
And Boz, okay.
Here, yeah.
Boz is here.
They may want to speak again.
Well, we'll do that. I know there are a million people who want to testify on it. Simple. Okay, thanks, Jen.
Yeah.
Representative Critchlow, here, you were here.
I am here.
Good morning.
Good morning.
This is your first visit
This is my first visit.
and
Be kind.
we're very kind.
I know.
So, but you don't know everyone, I think.
I don't.
So why don't we introduce ourselves for you,
Okay.
and then you can introduce yourself and share your information about the bill.
Absolutely.
Senator Hart from Orange County. Sam Brothers, Orange County.
Jenny Lyons, Chittenden Southeast.
Chittenden Central.
Washington District.
I'm Lady Critchlow. I'm from Colchester. I represent Chittenden 19.
Oh, good. Right next door to the rest of us.
Yeah, I got caught.
So you're, why don't you share with us, S80, and it's the healthcare advocate bill? And
Absolutely. It's my pleasure to introduce this one because I, in my professional life, have had many encounters with the Vermont legal aid. So
Oh, okay.
this was my pleasure to introduce this one. What the bill H80 really does is bring state law up to date with the practices and activities of the Office of the Healthcare Advocate since it was last updated in 2013. Coincidentally started as they tried the Affordable Care Act. And we actually voted this out of committee or it was like 10-01 in favor of the bill, and it's really quite simple. Section 1 just says that the health insurance rate review section will strengthen the healthcare advocate right to ask questions. The bill is really to put, give them a seat at the table as the not careful and, ask questions and find out answers. So that's the first part of it. Section 2 is just to review the certificate of need applications by the Green Mountain Care Board. Section 3, it's just the heart of the bill. It comprehensively updates Title 18, Chapter 229 of the Vermont statutes. Just looked at this chapter that creates the healthcare advocate and describes the office works on behalf of Vermonters and its relationship with state government. The bill more clearly calls upon the agencies of the state government to work with the healthcare advocate when making important decisions about state healthcare policy. And to make sure the office has a seat at the table, as I said. And we heard from a lot of people. We heard from the public policy director of Agency of Human Services. We heard from general counsel from the Green Mountain Care Board, staff attorney from Vermont Legal Aid, deputy commissioner of insurance from the Department of Financial Regulation, deputy chief counsel from the Office of Legislative Counsel, vice president of government affairs, chief healthcare advocate, state attorney, and director of the government and public media relations.
So overall, this gives, this helps the healthcare advocate relate with others in state government, like Agency of Human Services, to work better.
Absolutely.
Questions, committee? There was a phrase in here that was taken out, attributable nexus.
Oh, geez. That was the only one thing that we had.
That was one in there. We'll go through that with legal counsel.
Yeah, I'm sure she has more to say about it than I do. It was.
Any other questions?
I mean, my question was just, it seems like some of this is already, if not all of it is already happening, and this is just to kind of codify it. Is that
Well,
fair to say, or?
it codifies it and it actually like spells it out that it can happen now. Yeah.
So we'll hear from Mike Fisher on that.
Yes.
Yeah, that's a good question. Thank you very much.
Thank you. That wasn't scary at all.
We can do that if you want scary. Thanks.
Thank you.
Hello again, Jen Harvey, Office of Legislative Counsel. So now we will walk through the bill. Language up. It's H80. That's a good enough. And passed by House. Oops. Something like that. There are only a few changes, so just in case you don't get it all in context. So. All right, now I'll. This is H80 as passed by the House, an act relating to the Office of the Healthcare Advocate. And so, yes, this bill does make some modifications to existing statutory authority and expand some authority for the Office of the Healthcare Advocate. The section 1 is in the health insurance rate review statute, and this expands a bit the role of the healthcare advocate. Under existing law, the Office of the Healthcare Advocate can submit to the Green Mountain Care Board in writing suggested questions regarding a rate filing for the board to provide to its contracting actuary. Anyway, this would revise that to allow the office to submit to the board questions, not just suggested questions, but questions with a substantial relationship. Here was where there was briefly some language using the phrase articulable nexus that
Articulable.
yes, that I recommended.
Oh, that would be awesome to have in there.
So, because there was some confusion about what that meant, came from outside of the room. And so it now says questions with a substantial relationship to the rate filing and review criteria that the board shall ask the insurer either directly or through its contracting actuary, if any. So not just suggested questions that the board could provide that may or may not get asked, but actually being able to provide questions that will be asked, but making sure that there is some substantial relationship to the rate filing and review criteria. So narrowing the scope a little bit, but making sure the questions are asked. And then there's also a number of some crossing out of some language about or modification of what the board must post on its website and make available to the public. And in fact, this would make it broader, post on its website or otherwise make available to the public through a file sharing platform, all material in the review of a rate review proceeding after redacting anything the board determines to be confidential or otherwise subject to protection from disclosure by law. Right now, there's some sort of specific things and timing, and this just says put the whole thing up there. Section 2 is in the certificate of need process. So you may remember some of the work that we did and have talked about on certificate of need as part of, we haven't looked at it because there wasn't a proposed amendment. But as part of the certificate of need process, we talked a little bit yesterday as far as the timing of the bill and whether there were interested parties. And that would affect whether a pending application needed to continue or could be withdrawn. Under existing law, the Office of the Healthcare Advocate and for nursing homes, the Long-Term Care Ombudsman's Office is authorized but not required to participate in any administrative or judicial review of a CON application and is considered an interested party upon filing a notice of intervention with the board. So they don't have to prove that they're an interested party the way and have a reason to be added as an interested party the way others do. They're kind of automatically, if they want to be included as an interested party. This is not changing that. But this is, again, expanding the information that would be provided to the Office of the Healthcare Advocate or Long-Term Care Ombudsman if they have filed a notice of intervention. Under existing law, once they file a notice of intervention, the board provides the office with the information necessary to participate in the review process. And it gives some specifics about what would be included. This instead says that the office would have the right to receive copies of all materials related to the CON application and you'll actually see some amendments coming. There was we didn't finish making all of the requested amendments or considering all the requested amendments in the House. So if you want me to stop?
That's good.
Yeah.
Yeah, thank you. For my own education. So the long-term care ombudsman's office is in the Office of the Healthcare Advocate.
No, but it is also through a contract with Vermont Legal Aid.
Okay,
It's another kind of division or project in Vermont Legal Aid.
got it. Okay, and then when it says either office, it's referring to those
Exactly.
two. Okay, thank you.
Okay, so you will be hearing a request from the Green Mountain Care Board, and I think other stakeholders are in agreement as well to remove this number 1 here about allowing the Office of the Healthcare Advocate or Long-Term Care Ombudsman to ask questions of employees of the Green Mountain Care Board related to the board's review of the CON application. My understanding from the board is that they don't feel that's appropriate if one of the offices is an interested party, that they would have the ability to ask questions directly of the board employees about the review. So we will see an upcoming request to delete that, which makes sense. But they would keep language allowing either office to submit written questions to the board that the board will ask of the applicant in advance of any hearing held in conjunction with the board's review of the CON application, and submit written comments for board consideration, and ask questions and provide testimony in any hearing held in conjunction with the board's review of the application. And then we have language like we've seen in other places, that both offices shall not further disclose any confidential or proprietary information provided to their respective offices.
So, what I'm hearing, I think, is that there's still some discussion going on regarding, at least the little guy.
Yeah, I don't even think there's discussion. I mean, the discussion will be brought to you, but I think
that's
there
what I'm
is,
saying.
I'm not sure there are any dissenting views
Okay.
on whether that little I should stay. I think if my understanding is everybody is comfortable with it.
Yeah, all right, so we'll get the healthcare advocacy here
Oh,
in
good.
the front seat. Okay.
All right. Section 3 is amending the existing chapter in Title 18 on the Office of the Healthcare Advocate. First, looking at sort of overall and the composition of the office. So it starts with a broad statement that the Office of the Healthcare Advocate is established as an independent voice for Vermonters that is dedicated to promoting access to high quality, affordable healthcare for all. And a lot of the themes that you will see in the changes to this section are expanding the focus, which was originally fairly narrowly on health insurance and affordability of health insurance, to more broadly about access to healthcare and access and affordability, but not the narrower focus on health insurance, because in practice, that office does a lot more.
Well, yes, when this was established with the single payer in mind, it was, you know.
Yes, and I think it was also, this role, which used to be the healthcare ombudsman's office,
Yes.
was, I think originally, perhaps even predating Catamount Health, but really was focused on trying to help Vermonters navigate health insurance. So there were not as many options at that point, and ways that people were getting coverage, and it's really grown over time. And so I think this bill is reflecting the continued growth in the role. So these statutes, I believe, were enacted around 2013. At that point, really codifying some of what was actually happening, and even since then.
Oh,
the role
guys,
has grown.
while you're talking, all these memories come flooding back.
All right, so we have this broad statement about what the office is. And then more specifically to the office itself, in what would now be subsection C, the office under current law shall be administered by the chief healthcare advocate. This would say shall be administered by one or more directors, one of whom shall be the chief healthcare advocate. And I'll let the office explain to you the rationale there when they testify. And then it just reflects that there may be director or directors who would be hiring staff. Then in 9603, you start to see some of this broadening from this is the list of their duties and authority. So right now, the office shall assist health insurance consumers, and this would broaden that language to just Vermonters, and not just about obtaining health insurance, but obtaining and paying for health insurance, changing the term consumers throughout to be individuals or Vermonters. So you can see a fair amount of that. In number 3, one of their duties is to provide information to the public, agencies, members of the General Assembly, and others. And under current law, it's regarding problems and concerns of health insurance consumers. This would broaden that to say about Vermonters' problems and concerns regarding health insurance and access to health care.
Another question. How did you decide between individuals versus Vermonters? Because, okay,
Sometimes just the flow, just,
Okay. all right, so there's no like substantive.
No, there isn't, but I think in some cases it was, it seemed more seem more appropriate to kind of reflect the fact that we are talking, they don't assist anybody to understand, in number two, understand their rights and responsibilities under health insurance plans. They're really focused on Vermonters there. In the previous line, they're assisting individuals, it's talking about Vermont's exchange. So it really, you don't have to specify that they're Vermonters experiencing issues with the exchange. So sometimes often it's just whatever sort of seems more appropriate in my head at the moment. Yes. But yeah, I think some view of ensuring that the focus is on helping residents of this state and not national. All right, so an additional existing duty to identify, investigate, and resolve. And right now it says complaints. This would add questions and inquiries on behalf of individual, and right now it says individual health insurance consumers. So we'd say individual Vermonters with respect to issues regarding not only health insurance, but also access to healthcare, and assist them with filing and pursuing complaints and appeals. In 9.5, we have under existing law, provide information to individuals regarding their obligations and responsibilities under the Affordable Care Act. That's what current law says. This would expand that, but it would have provide consumer education to Vermonters regarding their rights and responsibilities under state and federal laws, rules, and regulations. So much broader than just specific narrow focus on the Affordable Care Act. Number 6, analyze and monitor the development and implementation of federal, state, and local laws, rules, and policies relating to, and under existing law that says patients and health insurance consumers. This would broaden that to say health insurance and health care, and with a special focus on patients' rights and eligibility for state and federal healthcare programs. Number 7, under existing law, it says facilitate public comment on laws, rules, and policies, including policies and actions of health insurers. This would revise that to say ensure policymakers hear directly from Vermonters by facilitating public comment on healthcare related laws, rules, processes, and policies. Number 8, existing law says suggest policies, procedures, or rules to the Green Mountain Care Board in order. So yes.
I'm wondering, well, this is not a question for you.
Okay.
Great, but it is a question about how can you ensure that we're going to hear from Vermonters if we don't?
Well, it says by facilitating public comment. So it's sort of,
How do you know my radio's turned off? Okay, so we're going to have to look at that a little bit because the word ensure is one that I happen to like, but in this case, I think I'm wondering why I got changed from facilitate, but we can look at that.
so number 8, again, under existing law, it says suggest policies, procedures, or rules to the Green Mountain Care Board in order to protect patients and consumers' interests. So modify that to say suggest not just to the Green Mountain Care Board, but to the Green Mountain Care Board, Department of Financial Regulation, and other entities in state government. Policies, procedures, or rules that protect and promote the interests of Vermonters in matters related to health insurance and access to health care. Number 9, existing law says promote the development of citizen and consumer organizations. This would modify that to say collaborate with other healthcare and health policy related citizen and consumer organizations to promote affordable and accessible healthcare for Vermonters. Number 10 changes just from patients and health insurance consumers to all Vermonters and ensure that they have timely access to the services provided by the office. Number 11 changes the timing of the Healthcare Advocates annual report from January 1st to January 15th. Otherwise, no changes there. In subsection B, in existing law, the Office of Healthcare Advocate may review the health insurance records of a consumer who has provided written consent. And based on the written consent, health insurer shall provide the office with access to records relating to that consumer. There is similar language and a proposed modification to that language coming later in this section. In 2, pursue administrative, judicial, and other remedies on behalf of any individual, and right now it says any individual health insurance consumer or group of consumers. This would expand to say on behalf of any individual or group of individuals experiencing problems with health insurance or access to health care. Number 3, existing law has the office represent the interests of the people of the state in cases requiring a hearing before the Green Mountain Care Board. This again expands that to say represent the interests of the people of the state of Vermont in matters involving health care and health insurance at the Green Mountain Care Board, the Department of Financial Regulation, or other state agencies. And then numbers 4 and 5, not change, adopt policies and procedures as needed and take other action if needed. C, under existing law, this is not changing too much, but the Office of the Healthcare Advocate shall be able to speak on behalf of the interests of health care and health insurance consumers. This says that modifies that to say that should be able to speak to Vermonters and on behalf of the interests of Vermonters in healthcare and health insurance related matters. And then the rest of this is keeps the same language, which is about not being subject to any retaliatory action. And then a new provision, and this is where that consent piece would come back in proposed language, I believe, that I've been discussing with the Agency of Human Services and others. So under the bill, health insurance, healthcare providers and health insurers shall cooperate with the Office of the Healthcare Advocate by providing relevant records and information when an individual or the individual's guardian or legal representative has authorized the office to act on the individual's behalf. So that's similar to the language that was repealed, but the Agency of Human Services as the Medicaid agency would like to specifically call out that they may require written consent from the individual or the individual's guardian or legal representative before providing information. So authorized, they would like it to be clear that that could be a written, could require a written authorization. The other parties seem to be amenable to that. So, okay. Then we have 9604, duties of state agencies. So in the bill right now, it says in developing state policy affecting healthcare access and affordability, state agencies shall seek input from the Office of the Healthcare Advocate. There was, I think, some concern expressed by state agencies about what the scope of this responsibility was. And so there is proposed language to clarify that this is sort of legislative intent, that the office would be consulted whenever there were matters of significant state policy involving healthcare. And so I have, again, when we look at this, I have some language that I have been working on with the outside parties.
Good.
Yeah. I think we're done with the proposed changes that I'm aware of at this point. Subsection B, in existing law, it says all state agencies shall comply with reasonable requests from the Office for Information and Assistance. This modifies that to some extent to say state agencies shall facilitate the office's meaningful participation in healthcare policymaking by complying with reasonable requests from the Office for Information Assistance, and this would add and access. And it would specify that a request shall be considered reasonable if it relates to the office's statutory duty and authority. Then, when appropriate, state agencies shall allow the office to access confidential or proprietary information that is otherwise exempt from public inspection and copying under the Public Records Act, and to participate in meetings, deliberations, and proceedings in which confidential or proprietary information is discussed. And that language was in the bill is introduced, and in the House they added provided, however, that nothing in this section shall require a state agency to provide or disclose information that is prohibited from disclosure by state or federal law, or that would cause the provider or disclosure to violate any statutory or common law privilege. So it sort of puts the Office of the Healthcare Advocate ahead of the general public in getting access to protected information, but it doesn't give them full access to anything that the legislature has or others have determined should be in fact confidential are not disclosed to anyone. And then, as we have seen in other language elsewhere, the office shall not further disclose any confidential or proprietary information provided to the office. We have an additional confidentiality provision, and under existing law, it says in the absence of written consent by a complainant or an individual using the services of the office or their guardian or legal representative, or the absence of a court order, the office, its employees, and its contractors shall not disclose the identity of the complainant or individual. This would change that to be more broadly that the office shall maintain the confidentiality of information related to individuals using its services in accordance with applicable state and federal laws, rules, regulations, and policies. Finally, 9606 is about conflict of interest. And there are existing provisions saying that the office, its employees, and contractors shall not have any conflict of interest relating to the performance of their responsibilities under this chapter. And it gives some examples of what that would look like to have a conflict of interest. New language would require the office to report any potential conflicts of interest to the Agency of Human Services, which holds the contract with the office. And then there's new language saying it shall not constitute a conflict of interest per se for an employee or contractor of the office to serve without compensation on the board of directors of a nonprofit healthcare entity whose primary regulator is not an agency of the state of Vermont. I'll let the office tell you a little bit more about that when they testify. Finally, Section 4 is the effective date. The act will take effect on July 1st.
Boy, it's going to be a really powerful healthcare advocate. Go ahead, Senator.
I'm not sure who this question is for, but I sort of have the same question for the previous bill, because they both seem like expansions of, you know, a certain amount of work within a certain body, and I don't see that either have appropriations or anything like that. So that they're going to try to.
That's a question that's a question that we can ask of the person who's be doing the work. You know.
Yeah.
Yeah.
Got it.
No, there is no additional money in here. I will let the healthcare advocate speak to how this fits with the work that they, I think a lot of this is work they already do.
I mean, I think, yeah.
This is, I think, right. It feels more like codifying what is happening and what would like to happen without so much angst.
Yeah.
Yeah.
Got it.
Right, and with giving some additional assurances to other state entities and others that
Right.
the information that they share
Right.
will be protected.
Yeah.
Well, where are we? We don't have anyone coming in. Can you check and see if Marty Portis is available earlier than 10:30? And maybe we can just keep.
Madam Chair, can I just say a brief
Sure.
process?
Yeah, please.
note?
Yeah.
I think there are, Mike Fisher, healthcare advocate, I think there are 4 or 5 updates to H80 that there is consensus on that Jen walked through. And their pleasure, one option would be to have me or my team come and present all of them. And certainly hear from the Green Mountain Care Board and DFR and AHS about whether it meets their what they're looking for. But I think sort of facilitating a process. I think we're all on the same page. These are details that.
And I do have I have a in process markup version to show where.
Good. Okay. So what we'll do is, as soon as you know that things look like they're ready to go, Kiki can schedule that in, can do it.
And I'll send this.
Diane to here to verify.
That's it.
Send it first.
Okay, good. Thank you. That's very good. Why don't